Welcome and thank you for joining U.S. Congressman Anthony Brindisi and New York State Attorney General Letitia James for a conversation regarding COVID-19 scams and how to avoid falling for one. There will be time at the end for questions and answers, so if you do have a scam-related question, please press 1 on your phone, which will indicate for us that you have that question. So as we can get as much information out as possible and get right to it, I'm going to turn it over to Anthony for some opening remarks. Anthony?
Well, thank you, Sarah, for moderating our discussion tonight. Good evening, everyone, and thank you all for joining us today. I especially want to thank New York State Attorney General Letitia James for giving us time tonight to talk to you about some of the COVID-19 scams and how to avoid them. As we all do our part to combat the global pandemic, it's important that we remain vigilant and on the lookout for bad actors who might want to do us, and particularly our older Americans, harm. We've already sacrificed so much by staying home, practicing social distancing, and doing our part to contain COVID-19. And as your representative, I've worked with members of both parties to secure crucial relief resources and equipment for our communities. I fought for money to get funding for our hospitals, checks to individuals and families, unemployment for workers displaced by this virus, aid to our small businesses, and crucial personal protective equipment to our frontline workers. Unfortunately, there are many people out there, scammers, who are trying to take advantage of the confusion and pandemic to rip off New Yorkers. In fact, my office came across a startling statistic this past week. Google blocks more than 100 million phishing emails daily that specifically relate to COVID-19. Tonight, Attorney General Tish James is here to talk to us about a few of those scams. And I want to thank her so much for her work protecting New Yorkers against these scams that are out there right now. She is a real fighter for consumers across our state, and we're so thankful that she's watching out for all of us during this very difficult time. I want to just give a real quick update and provide you all with a few items that are happening right now on the federal level. Negotiations are ongoing for future coronavirus relief, and I've heard from families, small businesses, and hospitals that we need more help here in New York. As our region starts to reopen responsibly, I'm doing everything I can to get us the resources we need. I'm fighting to make sure our frontline heroes like police officers and firefighters, healthcare workers, transportation workers, and the folks who have kept our spirits high and our economy going are taken care of. That means working with folks on both sides of the aisle to try and secure aid for our state and for our local governments. We've seen New York hit the hardest, but everyone on this call knows that New Yorkers have the toughest spirit and will work together to come out of this together. With that, I want to turn it over to Attorney General James. Her office is doing incredible work to fight back against COVID-19 related scammers and people trying to take advantage of programs designed to help our communities. Thank you, Attorney General, and the floor is yours.
Good evening. First, let me thank Congressman Brindisi for giving me this opportunity to join in this conversation together as we confront the many challenges that COVID-19 pandemic has brought all of us. The good people of the 22nd Congressional District are really fortunate and blessed to have Representative Brindisi's leadership in Congress, particularly at this critical moment in our history. He's not only working hard to address the immediate needs of residents and businesses in this district, his work with the Bipartisan Problem Solvers Caucus envisions better preparedness for New York and the nation in the event of a future emergency. I want to thank him for his leadership, and I want to thank all of his constituents for having a very good reason for voting him into office. And while we know that the majority of infections and hospitalizations and deaths from COVID-19 have occurred downstate, no part of this state has been spared. And the farmers and seniors and small businesses in the 22nd Congressional District face a unique set of challenges. One of the biggest of these challenges is making sure you have the knowledge and resources to protect yourselves from fraudulent schemes and scams and price gougers who are attempting to profit off of the COVID-19 pandemic. I basically call them bottom feeders. And I have some information that I'd like to share with you. But I want to begin by taking a moment to assure the family members and loved ones of those who have lost their lives that we continue to hold you in a circle of love and support, that we keep you in our thoughts and our prayers each and every day, and that I want all of you to know that when we come out of this on the other side of the mountain, we're going to come out stronger and more united than ever before, and no virus is going to defeat us, and we all stand together. But I pray, again, that the souls who have departed, that they are at peace. Nothing is more important at this difficult time than standing as one New York. Contain the spread of the virus, protect the health of residents, and safeguard the jobs and businesses that are so vital to this community. And I know you stand with me as we applaud the courageous healthcare workers and first responders who are risking their lives every day to keep us safe. They stand in stark contrast to all of those who want to take advantage of the anxiety and the fears that has gripped so many of us during this crisis. But we will not be paralyzed by this crisis. So first, let me tell you about some of the steps my office has taken to ease the burden and lessen the stress of New Yorkers. At this time, when so many New Yorkers have lost jobs and are struggling to make ends meet, the Office of Attorney General, we decided on March 17th to suspend the collection of state student loans and state medical debt owed to the state of New York for 30 days. And we have since extended that suspension for another 30 days. We've also been leading a coalition of 27 attorneys general from around the nation and calling on the United States Department of Education to provide federal student loan borrowers with crucial emergency measures to help in the wake of this pandemic. We've issued official guidance to New York State banking institution and creditors and debt collectors. Basically, keep your hands off the stimulus payments, that they will be exempt from garnishment under New York state law. If anyone attempts to garnish your federal stimulus payment, we are prepared to go to court and defend you in any action so that you can keep those federal stimulus payments to pay your mortgages and put food on the table. They're there for that reason. We are also reaching out to small businesses, local businesses, and have issued guidance to help them obtain loans through the federal government's PPP program, the Paycheck Protection Program. And I want to thank the Congressmember for his support for that, because he recognizes that small businesses are the lifeblood, the economic engine of our country. And we've provided these small businesses warnings and tips to protect them from lenders and agents who fraudulently and deceptively market these loans. In fact, some have been calling New Yorkers, basically seeking their personal information, their banking information, their Social Security information, claiming that they're from government. Please know, family, that government would not knock on your door and or call you and ask for your bank information and or your Social Security. And so particularly senior citizens who they prey upon. I think the Congressmember and I join in giving you the right and the authority to hang up on these pranksters who basically are trying to take your hard-earned money out of your pocket. We reminded the public of our hate crisis hotline in response to the rise of bias-based incidents against the Asian American community. We sent letters to 35 major mortgage servicers calling on them to provide immediate and long-term relief to all New Yorkers struggling to pay mortgages in the midst of the pandemic. And some of the major mortgage servicers like Citi and Wells Fargo, they have provided relief in the form of forbearances and other types of relief to homeowners in the state of New York. And I'm particularly concerned about senior citizens who have taken out reverse mortgages. And so we have been working with mortgage services to provide relief to senior citizens who unfortunately are not in a position at this time to pay back their property, to pay property tax and on interest on those and taxes on those loans. And we do not want to see foreclosures, an increase in foreclosures as we did during the last economic meltdown. We stand in solidarity with New York workers and have responded to over 3,000 contacts related to labor issues, guidance to workers, and ensuring that they know their rights under the law. And we've been working with the governor's office, again, providing clarification to countless consumers and businesses with respect to the executive orders, and we've been helping him as we help him craft those executive orders. We've also contacted over 375 employers. We sent out 35 letters to ensure employers are complying with the law. We are continuing to urge that the district court, federal district court, halt the implementation of the public charge rule, which would deny green cards and visas to immigrants that use government assistance programs, because, my friends, this really is a humanitarian crisis, and there are families who unfortunately are suffering from food insecurity, both individuals who are Americans as well as immigrants, and it's important that we provide assistance to all families, particularly those with children. We are working with Governor Cuomo to investigate the severe crisis of COVID-19 ravaging nursing homes throughout the state, and so we have a responsibility or a charge that the governor has provided to basically inspect and to investigate the complaints that have been filed in our office, because right now nursing homes, as we all know, is a petri dish, and the residents in nursing homes are frail, and we need to make sure that they are protected and secure against this pandemic. We also need to ensure that the staff members are also protected, and we need to provide information to the loved ones who are concerned about the residents, their loved ones in the nursing homes. In response to the shortage of PPE for healthcare workers and first responders, we seized, as part of some investigation, 33,000 gloves and 1,700 protective masks, and so we donated those gloves and those masks to New York State Office of Emergency Management to bolster the state's response to COVID-19. All of you need to be on the lookout for scammers who are attacking from multiple fronts, from the telephone, the internet, even door to door. And these scams run the gamut from people calling and claiming to be, as I mentioned earlier, representatives from the federal government and or state government, individuals knocking on door pretending to be representatives from the Centers for Disease Control and offering tests for COVID-19 for a fee. Family, please know that COVID-19 is free. The recently passed CARES Act guarantees free COVID-19 testing for all, including individuals using private insurance. No one should be offering a test for payment. Most testing sites require that you have an appointment, but please do not pay for any COVID-19 testing. We have received a lot of complaints about price gouging, in fact, to the tune of 5,700. We've issued more than 1,400 cease and desist orders to businesses and suppliers and wholesalers. We've had several conversations with supermarkets and other businesses and constituencies all across the state of New York. We've worked with online platforms, again, to remove posts for fake COVID cures and remedies. Please, family, know that there is no cure, there is no treatment, there is no potion and or lotion or toothpaste that can cure COVID-19. The only treatment right now is a trial drug known as Remdesivir, and it's being used on a trial basis throughout the state of New York. Other than that, that's the only FDA-approved trial drug, but you cannot obtain Remdesivir on the internet, and if you do, obviously you're putting your health in jeopardy. These are just some of the actions that we've taken. There may not be a vaccine at this point in time, but they're working at it. All indications suggest that the earliest we'll get a vaccine is perhaps sometime next year. I think the best defense at this point in time is social distancing, wearing your mask, staying at home, public awareness, personal vigilance, information, and obviously working with your great Congress member and my office and others as well as we work together to avoid you becoming a victim. I want you to know that my office stands with you. We are continuing to respond to complaints of price gouging as we work remotely from home, and we are aggressively going after these bad actors who are taking advantage of consumers during this crisis. Our first responsibility is to protect the interest of New Yorkers, and we're doing just that. But I do know that when the sky seems the darkest, that's when the stars shine the brightest. And clearly, New York has a a number of stars, and they are all shining bright. And that includes all of the constituents that this Congress member represents. Congressmember Brindisi, thank you for allowing me to say a few words, and I turn it back over to you and or Sarah.
Thank you, Attorney General. Sarah, I'll if it's okay, maybe I can start off with the first question to the Attorney General. Attorney General, we get a number of calls into our office about email scams and other scams that come over the internet. Can you speak a little bit about the importance of consumer awareness surrounding email scams or other scams that people might find online, and how maybe technology companies can play a role in reducing exposure to these COVID-19 related scams, or what your office is maybe doing working with some of these companies?
Thank you. So on any given day, these online platforms have to block millions of posts and foreign interests and even domestic interests who seek to defraud you out of your money. And so we have been in contact with a number of these online companies from, you name it, and we have been in touch with them, urging them to take down posts and urging them to cooperate with our office to investigate individuals who deceptively engage in marketing of products and or cures and or treatments to COVID-19. We have been successful, but each and every day there's a new scam that avails itself. And so I think the best defense right now really is public awareness and education, and reaching out to elected officials like the Congressman Brindisi and his staff, and reaching out to our office. It's unfortunate, but a significant number of these fraudsters are international, and our jurisdiction, as you know, is limited to New York. And so we work with the Department of Justice because they have jurisdiction over these international interests, and we try to coordinate efforts to go after these pranksters. But the number of bottom feeders, and unfortunately, increasingly, it just doesn't amaze me. But we are available, and we will investigate any and all claims, and or we will reach out to our partners on the federal level and work collaboratively to take down posts and to take down pranksters who seek to take advantage of individuals at this hour of during this period of crisis.
Thank you so much. And I know that our office has referred a lot of constituents your way, and then we've also heard back that they've gotten great advice whenever they're concerned they may have been scammed. Just want to remind everybody, if you have a question, all you have to do is press 1 on your phone, and it raises a virtual hand for us here so that we can see that you have a question. Anthony, did you have another question you wanted to ask the Attorney General while we're waiting for some questions to percolate through, or?
Sure, I can ask another one. General, I know you brought up price gouging, which is something that many of us have been seeing on the news. Can you talk about some examples of price gouging that your office has seen since this crisis began, and what steps you're taking to address them? And what do people do if they see that in the community? How do they report price gouging?
So that's a great question. So when this pandemic, when we first saw it in early March, around March 15th, March 17th, the complaints to our office primarily focused on hand sanitizers and masks and things related to keeping us all safe, primarily PPE. We have seen price gouging transition now to food, and a significant number of complaints to our office focus on the price of eggs, meat, and toilet paper. Not necessarily in that order, but it's primarily essential products that we need at home. And that has been very interesting. And so let me talk a little bit about meat. Congressmember, you know that there have been some issues with regards to the meat packing industry in the heartland. And so there's a issue with regards to the supply chain. And so we have reached out to supermarkets, we've reached out to manufacturers, we've reached out to the industry to try to get an understanding of why. Is it just a shortage of meat that's causing the prices to go up? Is it just capitalism? Is it, just the demand exceeds the quantity that's out there? We have also had questions with respect to toilet paper. And we've discovered that residential toilet paper and the price of residential toilet paper is different from commercial toilet paper. And commercial toilet paper is not in as much in demand as residential toilet paper. And I really didn't know that there was a difference. But apparently there is, and it affects prices. And the question is, but what has that got? What has that to do with the increase in toilet paper at all? Is there a breakdown in the supply chain, or are individuals price gouging? A number of supermarket owners indicated, Tish, that's my nickname, they said, Tish, well, we may have a couple of bad actors, but the vast majority of us are trying to do the right thing because we want to maintain our customer base. And so we have sent out investigators based on our complaints to a number of stores. If you have specific complaints, please send them over to my office. I'm sure that Sarah will put up the hotline that we've established and our consumer fraud telephone number where individuals can reach out. As you know, we've got regional offices that you can reach out. We've got some staff members who are on the call today. We've got Ed, we've got John, we've got Pat, we've got Mike, who can also answer individual questions and respond to complaints related to price gouging. And lastly, eggs, and we're still trying to understand eggs. Why is there, again, an increase in the price of eggs? It may be similar to the meat packaging industry, and that is perhaps in that area, that industry too has been impacted by COVID-19, and therefore the demand is more than the supply. And so we're looking at all of those issues, and I thank you for allowing me to give this long explanation. But I'm becoming an expert on meat and eggs and toilet paper.
I bet you never knew that would happen when you signed up for this job, Attorney General.
I had no idea, but it's rather interesting. It was very, very interesting.
Well, Sarah, do we have any hands raised there? And I do want to say, just before you take the next question, I really do appreciate, I want to commend your staff, Attorney General. We work very closely with your offices in Utica and Binghamton and the Syracuse office as well, and your office is very responsive, and I really appreciate the hard work of your staff who help our office navigate these issues all the time.
I appreciate it. And I thank you for all that you do. And as we reopen the state, and I know that there are 4 regions that have passed the test, who satisfy the criteria set forth by our great governor of the state of New York. I want to thank him for his leadership. And I just urge everyone to go slow and that we continue to practice social distancing and recognize that we still need to monitor our actions, and we still need to be tested, and we still need to engage in contact tracing, and hopefully one day we will have a vaccination so that we can all return to some semblance of normalcy.
Absolutely. Thank you guys so much. So we do have some questions. We've got one from Janet Lenacek. Janet, can you hear us?
Yes. Can you hear me?
We can.
Yes, Janet.
Okay, great. I'm in the Buffalo, New York area, and I've been spending a lot more time online lately with Zoom and other things. But I've noticed in the last 2 months, I've now received 4 different requests online that are, what they are, it's dear customer, we have placed a hold on your Amazon account and all pending orders. And I haven't even ordered anything from Amazon. So right away I thought, what the heck is this? It looks very fishy. What they're asking for is my billing name, address, phone number. I have not responded, but I've received a couple of these from Amazon and 2 from what is supposed to be PayPal, but I know that looks fishy too. They never ask this information, and I've checked my accounts and they look fine. There's nothing there. Somebody's trying to get this info. Is it best for me to report this to the Buffalo office, or should I be reporting this? Okay.
Please reach out. Yeah, please reach out to our Buffalo account. We've been seeing these scams as well. Amazon would not say dear customer, so please reach out to our Buffalo office. They're working remotely from home, but they are available to look into the matter, and I really appreciate it, Jana, and thank you so much. And congratulations on Zoom. You know, we reached an agreement with Zoom to protect your privacy and your security, and so continue to Zoom on.
Well, thank you so much. Do you have a phone number available handy for that office, or is it on your website?
It's on our website.
Okay, I'll check it. Thank you so much. I really appreciate it.
Thank you, Jana. Be safe.
All right, that's great. We've got another one from Henry Stack. Henry, can you hear us?
I certainly can.
All right.
Can you hear me?
We can.
Okay. Can I just go ahead?
Yes, Henry.
Hi, Anthony. Good to hear you again, and I hope you come to Cortland to visit again.
We'll be in Cortland soon. I can't wait to see everyone in Cortland. Thank you, Henry.
Okay, so I have a couple of questions. You can take them in order. I've been following Governor Cuomo's daily lectures on the epidemic, and I hope that the federal government can help. I don't know if you've seen any of them, can help provide the hospitals with equipment and PPE for health providers who are stressed by the large numbers of patients coming in. So I'm just passing that on. Nobody I know has been effective, and I've been sheltering in place for 3 or 4 weeks now, getting some work done around the house. But here's my question. Do you think that either this year or when the Democrats take back the House next year, there'll be some more advances in health care, either Obamacare or even along the lines of what Senator Sanders called Medicare for all? I just think we need more assistance for prescriptions and health care. And of all the national issues, that seems very important to me as a retiree. And thank you for holding these sessions. They're really terrific. And thank you for the Attorney General. I hope she comes upstate to visit. She was supposed to come to Cortland to speak at our dinner, but we were forced to postpone it. So I look forward to meeting her.
Henry, I look forward to meeting you in person as well. And as soon as this is over, I can't wait to get to Cortland. I'm going to...
Fabulous.
Yes, those questions are, Congressmember, I think they were posed to you.
Yes, I can take those. So thank you, Henry, for the questions. On the first issue, yes, the PPE has been a great disappointment, and seeing many of our healthcare workers and frontline workers have to go into hospitals and nursing homes, or the folks that are working in grocery stores or delivering our goods, to have them go without proper protection, to me, is like asking a soldier to go to the front line of a battlefield without a rifle. We should never, ever do that. I'm very glad that we've been able to put more funding in place through the various response bills that we have passed to supply more PPE to our healthcare workers. But we're still nowhere near where we should be, and quite frankly, we need more of a national strategy with regard to the personal protective equipment. Otherwise, you're going to see what's been happening is many states and localities and hospitals have had to compete against one another to get this equipment, where it's really the federal government's role and the administration's role to secure this and then get it out to the areas around the country that are hardest hit. and obviously here in New York, we are the epicenter. So we're working on that. Another issue that I'm working on is really looking at our supply chain and how we can become less reliant on adversaries like China for personal protective equipment and medical supplies and pharmaceuticals. So that's another issue that I'm working on and have some legislation to address that. Moving forward, healthcare is one of the most important issues in our nation, and we're doing so much right now to try and prevent those out there who want to take away healthcare from individuals. You may have seen some of the news about court cases filed to try and dismantle the Affordable Care Act. I think that would be a big mistake. Everyone should have access to affordable health care. It's a right. Shouldn't be a privilege for those who can just afford it. And we need to make sure that we're helping to make health care more available and affordable for everyone in this country. So I thank you, Henry, for your questions.
All right, we've got a couple more questions, but just a reminder, if you have a question to ask, all you have to do is press the number 1 on your phone keypad. So we have a question from Donald Colangelli. I apologize if I'm not saying that right. Can you hear us?
Listen, what are you going to do about local city and county, or what can you do about alleviating the tax structure? We now have public schools in Cortland that want to have a $50 million renovation budget, and they also want to increase our taxes 1.7% to pay for teachers' retirement and benefits. The rank and file cannot afford these increases any more than the county and city can afford to lose them. But why should we be put in a position of paying for a system that isn't working, hasn't been working for the past 2 or 3 or 4 months, and we don't have the money, the rank and file, to support that system until everybody gets back to work and starts earning funds again, money again. So it's a situation that needs to be looked at and worked on, and some kind of alleviation, or the taxpayer be alleviated from the pressure and, this absurd taxation at a time when we're all struggling to keep our heads above water.
Donald,
okay.
Okay.
Go ahead.
I just wanted to say to Donald, as the Attorney General, I don't have jurisdiction in that particular area as it relates to redesigning, restructuring your tax system on a local and or county basis.
And I'll just say real briefly, Donald, you raised some excellent points. I can tell you also as a federal representative, I don't have jurisdiction over the local or the county taxes. I will tell you this, though. I think it's very important moving forward as we look at coronavirus response and further legislation in Congress. One of the big stresses that is being placed on all of our local governments and our state government is just a tremendous drop in revenue, loss of sales tax because of businesses being shut down. And many of our local governments and schools and the state are going to have to make some very tough choices if we don't get some help from the federal government. And here in New York, because it is the epicenter, I think we certainly deserve some assistance in our time of need. So what I fear is that if we don't get that assistance, you're going to see a lot of those taxing jurisdictions raise taxes to try and cover their losses, and that's going to hurt all of our taxpayers here across New York, and it's certainly going to affect our public safety, our public health, our education system, and we don't want to see that happen. So that's why I'm heading down to Washington as we speak and trying to work on trying to get some more aid into our local governments across the state and our state as well to help support and try and prevent any of these tax increases that may be down the road.
All right, great. We've got another question. This one's from Sonia Martinez. Sonia, can you hear us?
Yes, I can hear everyone. Thank you,
We
Sarah.
can hear you. Hi.
And thank you, Anthony, and thank you, Leticia, for coming to our area, even if it's via the phone line. Thank you very much. But I just wanted to comment on, along with the lady that talked about the Amazon account, that Facebook accounts are also being hacked. I've had very many clients of mine complain that my account, I guess, was hacked, and they were receiving friend requests, and they looked weird. They didn't have to have my picture that I currently have, so they knew that it wasn't me, so they sent me messages. And I've had other people, too, saying that their Facebook accounts and WhatsApp, that's the other phone app available for people that are being hacked also. Just want to report that. Thank you for your time, everyone.
Thank you, Sonia. We are aware, again, of a lot of hacking that's going on Facebook and WhatsApp, and a number of online platforms, as well as on a number of telephone apps. And so we are working with the industry, telecommunications industry, as well as with these online platforms to try to address the scams that exist, as well as trying to prevent and foreclose the possibility of having your account tapped into or taken advantage of. And so that's what we are doing. Obviously, it takes a lot of time, a lot of resources, but most importantly, it's going to also take, and we have been working as partners with the federal government, with the Department of Justice, in regards to this issue.
Thank you.
General, I know one thing I wanted to ask, because it is another issue that comes up a lot in our office, and I think it's really, really sad in our country that older Americans are often the target of fraud and abuse, especially in a crisis. It seems like these things really spike up whenever there's a crisis happening, right? I wanted to just get your thoughts, and perhaps maybe you could offer the people on the call some tips. How can older constituents identify and avoid being scammed? Are there things that they should be looking for, some common themes across the board? What are your thoughts on that?
Yeah, again, I've worked very closely with a number of organizations that focus on senior citizens. And one thing you should know is that most companies will not ask for your private information. Most individuals will not ask for your Social Security number and your bank account information. And businesses that ask for money up front, there should be a light bulb that goes off in your mind. It's really critically important that individuals reach out to, again, their local elected officials, that they reach out to advocacy groups and allies on the ground, because unfortunately the vast majority of this fraud is being conducted, is targeted towards vulnerable and marginalized populations, including but not limited to senior citizens who fall victim to these marketing schemes. And that's all that they are, marketing schemes. And right now, what they are doing is, again, using COVID-19 as an excuse to basically take money out of your pocket and or to garnish your stimulus money that you are receiving from the federal government. And so I urge everyone to be vigilant. I urge everyone, again, to reach out to their local elected officials, and that we should all work together to try to protect this particular constituency, senior citizens, who are getting calls such as individuals who are saying your relative, your loved one, unfortunately is in some other country and they can't return home. They need X amount of dollars in order to return home. And then you find out that your loved one is safe and secure somewhere else. And people I know people who sent thousands upon thousands of dollars or some other type of scheme related to a loved one. What I would do is get their number, tell them you'll call them back, and then call your loved one and see if they're okay. Always check and verify. That's the most helpful information that I can give you at this point in time. Just verify. And if they are not prepared to give you your information or allow you some time to think about purchasing a particular product so that you can check it out and do some research, then that should raise some concerns.
All right, thank you so much. I'm looking at our time, and I'm thinking maybe one more question before we go to closing remarks. We've got a question from Barbara Slocum. Barbara, can you hear us?
I can hear you.
We can hear you.
I have a question about a question. Yes, it's a questionnaire I received in the mail, and it looks totally legitimate from Simply Prescriptions, and also it says the Centers for Medicare and Medicaid Services. But some of the questions are very personal. Do you have difficulty climbing or walking? How many people live in your household? What is your race? Are you Hispanic or Latino? And sometimes you do get these questions on a census. But I had never received this before, and I'm wondering how can I tell whether it's legitimate or not? Just because it looks legitimate doesn't mean it is.
Exactly. And oftentimes a lot of these bottom feeders design questionnaire forms that are similar to government. And so I do not know of any federal agency that is seeking this information. The only information right now that is being circulated around New York State and around our country is the census, and the census basically asks basic, simple identifying information. I don't know whether or not Medicaid or Medicare is seeking additional information. I'm unaware of any such form being circulated right now.
Okay, I think I'll just send this on up to Mr. Brindisi's office, and they can check and see, and I just won't fill it out for now, and maybe they can give me a better answer once they look it over.
Excellent. Thank you.
Okay, thank you.
Yep. Feel free to send on over to us, and we can check it out and try and get you an answer as to whether it's legit or not.
Yes, absolutely. Better safe than sorry. We can run that right by Centers for Medicare and Medicaid for you. So really, we've really come to the end of our time so that we can allow for some closing remarks.
So let me just say that, the young lady brings up an excellent point, and that is while we are home pausing, all of us should fill out the census form. Our response rate in New York is around 52%. We need to do better than that. It's important that everyone fill out the census. You can go online and fill out the census. The census is absolutely critical because it relates to reapportionment, the number of representatives that we send to Washington, D.C., and obviously we want more great representatives similar to Congressmember Brindisi. And two, it relates to resources that we are owed from the federal government. And at a time of this, during this pandemic, we can certainly use more resources. We send more money to Washington than we get back, and clearly this is one way that you can take part in ensuring that we get the much-needed resources that we certainly deserve. I want to thank the Congressmember for this opportunity. I want to thank Sarah and his entire staff, as well as my staff, for all of their assistance. And I want to thank all of you for tuning in and for being active participants in your government, and which is, again, one of the strongest aspects of democracy. And I really want all of you to know that this pandemic shall pass. We're going to come out stronger, more united together, and that we're New York strong, and we will not be divided. We will not be impacted we will not be impacted adversely by this virus. We're going to stand together, New York strong, because that's who we are. And so, again, thank you, Congressmember, for all that you do. and bless you and your family. And everyone on this call, please, please continue to be safe. Thank you.
Thank you, Attorney General. I want to just say thank you again for participating in this call and being a resource for the constituents in the 22nd District and across the state of New York. It's nice to know that we have a cop on the beat watching out and protecting us from these scammers who are trying to take advantage of us and our loved ones. And I really appreciate your advocacy and all the support that your staff and hard work that you do keeping New Yorkers safe. Thank you so much.
Thank you.
Thank you so much, everybody, for joining, and please don't hesitate to reach out to the Congressman's Utica office at 315-732-0713 if we can help with any federal issue or help connect you with your state elected officials or to the Attorney General's office. Thanks so very much. Have a great day.